If you smile and have those teeny tiny little crinkly lines right by the side of your nose, sometimes we call those bunny lines, and you're wondering, is there anything that we can do about them? Let's talk about how Botox can maybe treat your bunny lines or those wrinkles on the side of your nose, or sometimes those lines just come up out of the blue, and I can explain to you why. Let's talk about bunny lines today. I'm Dr. Lynn Neiman. I am a board certified anesthesiologist and aesthetic medical provider at Blossom Medical, which is in Northern Virginia. Remember, I am a doctor, but not necessarily your doctor, so this is really general advice and information for you. But if you find this information valuable, I would love it if you would like and subscribe below. You can also send me any other questions that you have about specific things that you may be experiencing, and in a later video, we'll try to answer those questions as well. Bunny lines, those little teeny tiny lines that crinkle at the top of your nose, are caused by a muscle called the nasalis. That muscle kind of reaches right over the bridge of your nose, and that muscle interacts with a muscle that goes around your eye called the orbicularis oculi, and it also interacts very much so with the muscle that pulls your eyebrows down in the middle of your forehead called your procerus. And those muscles, and some people are strong, even in some kids, you can see when they smile, you can just see those bunny lines come up out of the blue. I actually really kind of like those bunny lines when I see them. I think they're very cute, but not everyone thinks they're cute. And some people would like for me to treat them and make them go away. Um, so if that's you, it's a really, really simple treatment of a couple of Botox units, depending on how strong that muscle is. It can be anywhere from 2 to 6 units on each side of those bunny muscles to help to quiet them down. Sometimes those little wrinkles on the side of your nose can get stronger if you've had a Botox treatment done in your upper face for a while. Let me explain why. So earlier in the video, I said that that muscle plays with the muscle that goes around your eye called your orbicularis oculi, and it also kind of plays or interacts with that procerus muscle in the middle of the forehead. So the nasalis muscle is a recruiter muscle for pulling down on your brow. So if you've had Botox treatments over years, in the middle of your forehead, over time, the nasalis might start to recruit because it's helping to try to pull those brows kind of in and down. And so sometimes, even though you haven't had bunny lines in the past, when we kind of treat the glabellar complex or those 11 lines in the middle of the forehead, we can actually cause those bunny lines to form. If they do, we should just treat them with a little bit of Botox. And again, that's due to the interplay between the muscles of the glabellar complex, especially the procerus, the one right in the middle, and the nasalis muscle. In addition, when we treat the crow's feet, typically we're treating out in the lateral portion of the eye. So sometimes we get a little eyebrow lift, and then we treat the lateral portion of the orbicularis oculi that goes around the eye. That muscle going around the eye is like an O, like the letter O, or kind of like a donut or a bagel. And that muscle, when it contracts, it kind of squeezes in. When it relaxes, it opens up. So if we're always treating with our Botox treatment over time, that lateral portion, and that's relaxing, sometimes the portion that's on this side starts to contract in compensation. It's just the way that muscles work together. And so as this side contracts in a little bit of compensation, it can actually recruit that nasalis to become a little bit more prominent. And so sometimes we start to see that nasalis develop, and it almost looks like your crow's feet are kind of extended a little bit on the lower portion, but we call that lower fan of the crow's feet beneath the eye itself. And when that happens, if we actually treat the nasalis, it will relax the lower portion of the crow's feet and relax the tension that's developed medially as we have over time treated the lateral portion of the orbicularis oculi. So remember, muscles go together. We can't treat muscles in isolation. And sometimes when we've had a really beautiful treatment with Botox, it still behooves your provider to take a look at your face, the way that things have developed and changed over time. So maybe 5 years from now, 10 years from now, there may be other areas that it would be ideal for us to treat in order to keep your overall treatment looking balanced and beautiful because our muscles are smart. You can think of it this way. If you've ever had a cast on and you've taken the cast off and your muscle has atrophied, when you start working again, that muscle comes right back, right? That muscle will come right back once you start working it out because our muscles have memory. Our muscles will also really work together as groups. So if you've had a cast on, you may notice other muscles. So if you've had a cast on your lower arm, you might notice your upper arm kind of like builds a little bit while that cast is on, or that you notice that those muscles are really kind of working overtime. It's because the partner muscles, those pairing muscles, will try to compensate for muscles that aren't working as well. Our body is so smart, and our body is going to find ways to kind of really work those muscle groups together. So that happens with our Botox treatments of our upper face. We may, over time, see that our body has tried to compensate in other ways that we need to have an aesthetic eye for, and we need to have conversations about how we could possibly treat those. So some people just naturally have those little crinkly lines at the top of their nose. I find them to be absolutely endearing and love them. Not everybody does love them and wants them treated. And we can treat those either in isolation, actually, or we can treat them as part of your upper face Botox treatment. Sometimes those bunny lines develop over time because we're recruiting that muscle to work a little bit harder because the muscles around it aren't working as hard. Those muscles typically are in that glabellar complex or the orbicularis oculi, the one that we treat when we're treating crow's feet. And if we've treated those for a while, sometimes that nasalis, that muscle on the nose, tends to recruit and get a little bit stronger. So if we give it a little bit Botox, we can ask it to just kind of simmer down just a little bit so that we don't see it. And also that may have good and wanted side effects like reducing the lines that we see underneath the eye. So absolutely we can treat the nasalis muscle, and absolutely we can treat it for an aesthetic purpose alone or to help compensate for the way that our muscles are playing together. I hope this information was helpful for you. If this is something that helps you get a better treatment, I would absolutely love it and appreciate if you would like and subscribe down below. If you happen to be in the Northern Virginia area, I would love it if you would stop into Blossom Medical and see me in consultation. We can talk about what kind of Botox treatment is right for you and how you can get the very best results that are possible from a Botox treatment. You can find the link to Blossom Medical below, and you can either call us or you can go online and schedule a consultation that way. If you are nowhere near Northern Virginia but still are interested in what our practice can offer for you, we do offer online skincare consultations using Zeo Skin Health, and we can really help you just find that transformative skincare regimen that's going to help you look and feel your best. And at Blossom Medical, and just me as a person, it's the absolute joy of what I get to do in my profession and in my place that we've created, our haven that we've created here, to really help people look and feel the best about themselves. Thank you so much for tuning in today. Feel free to share this with any friends you think might find this information helpful, and I hope to see you at another video at another time answering another question that helps you make great choices about your aesthetic treatments. Have a great day.